Hello, my name's Emily Gleatis. I'm a physiotherapist and I'm a yoga teacher, and I have a particular interest in yoga-related injuries, having suffered a few myself. So today's presentation is all about the state of yoga and injury in Australia. This presentation is based on information I put together on behalf of Yoga Australia, and I presented it to a sold-out workshop earlier this year. So a complete yoga practice does involve all 8 limbs of yoga, but today we're going to focus on yoga asana because it's a very important and very popular part of yoga in Australia. And when we get injured during a yoga practice or our injuries get aggravated, then it can be particularly distressing. So I wanted to share a little bit about myself first. So I started yoga while I was studying physiotherapy at uni. And I completed my Bachelor of Physio in 2006. I had suffered multiple injuries over my lifetime. Hip, back and wrist were a few, and not just during yoga, but they were certainly could be aggravated by yoga. Enough that my running distance, which is also important to me, was limited to about 4 kilometres. Had to give up netball. I kept doing my yoga, and in 2008 I did my yoga teacher training, and I was one of a handful of people who got injured doing my training. I discovered Connect Therapy in 2012, and when I returned for my advanced teacher training later that year, I was pain injury free. In fact, I felt great after this the advanced training, whereas again a few other people unfortunately got injured. So between 2013 and 2015, I actually completed 3 half marathons, which is over 20 Ks. And just to test myself out a little bit more, in 2015, I completed a full marathon, which is 42 kilometres. Not just to boast, but it just shows that my capacity for running and movement and physical activity had improved about 10-fold from where it was back around 2006. So my mission is to make yoga more enjoyable and safer for everyone. I want to take a look at what we do and why. I think sometimes yoga is approached a little bit dogmatically. We just do things because that's the way it's been done, but we don't always stop and think, is this the best way to do it? So I'd like to discuss if there might be a better way. I'm really interested in exploring what stiffness means and how we can improve it, which is a little bit outside the scope of this presentation today, as well as addressing some commonly held misconceptions, and like I said, considering the scientific basis behind why we're doing what we do. So my approach is a bit unique in that it's informed by Connect Therapy, which is a whole body, whole person approach. So this lady here is Dr. Linda Joy Lee. She's a Canadian physiotherapist, researcher and clinician, and she's developed Connect Therapy as a way of looking at the whole person, looking at what's dysfunctional in their body, and some things are painful, some are non-painful, and assessing everything to determine what is the root cause of this person's problem. And it's a very unique approach. The way I've applied it to my yoga practice is focusing specifically on what's meaningful, so that each specific posture, there's some that we have trouble with and there's some that we don't. And yoga requires that we move our bodies in a huge range of motion in a variety of ways, and the load can come from different directions. So in down dog, we're loading through our arms. In standing postures, we're loading through our legs. In twists or side bends and some of the really complex postures, there can be load coming from different directions, inside and outside of the body. So with the Connect Therapy approach, we realised that there's many mechanisms, like pain, injury, or just habits, or what we do for work, what we have done, that we kind of get into compensatory movement patterns, and when we've got these patterns, it locks us down and we're not able to use our full range of motion, and therefore the same structures tend to get overloaded. So we get essentially overuse in some regions or tissues of the body and weakness of others that we can't quite access. And it's especially because yoga, depending on how frequently we practice, how many times we do the one posture, either within the session or over the weeks or months, or how far we take it into the range of motion can all affect how we load the tissues. So, if we look at yoga in Australia, 30 million people practice it globally, but in Australia it's the fastest growing form of physical activity, a double basically in the last 10 years, so that now 1 in 10 Australians are now practicing yoga. But the injury rates increase as people become more physically active. So there's some evidence that about 10% of people who become physically active will get injured. The risk of injury increases with the frequency, duration, intensity of exercise. And there's some evidence that about 10% of yogis get injured and about 20% will have old injuries re-aggravated. The troubling thing is that yoga-related injury seems to be increasing faster than the rate of participations, with practitioners over 65 years old being the most at risk. And the large majority of these affect the trunk, and the second most common is the lower limbs. So I invite you just to have a little think about what you think is the most risky postures. And it might help if you consider it in 2 categories. There's a small number of very serious injuries that occur, and there's a large number of less serious injuries, which are more like sprains, strains, and that repetitive strain type injury. So if you guessed headstand or shoulder stand, you would be correct, based on my review of the literature of case studies. So the most severe injuries are often reported as a single case study. And there's a list of the postures that are often associated with more severe injury. So I think it's important that we just touch on Sujasana, a headstand. So most of the serious related injuries, so there's 10 here, that are related to occlusion of a vertebral artery or an artery within the neck and head that can lead to stroke. So some of the instances were of stroke. Glaucoma and optic neuropathy and optic vein occlusion. So that's to do with the blood flow and blood supply to the eyes, the veins of the eyes, and nerves to the eyes. And it can be really serious because it's irreversible. And a lot of the time there is no prior symptoms. So people don't often know that they're suffering glaucoma until it happens. So risk factors for stroke, increasing age. If you're a guy and if you have a family history of stroke, you're more likely to suffer a stroke. Hypertension, high cholesterol, smoking, being overweight, having a poor diet or excessive alcohol intake. So one of the mechanisms that injury to the cervical spine or the vertebral arteries which run through the neck, which I should go back. So this picture here shows the vertebral arteries, how they pass really close to the spine in the neck. So injuries to the neck or end of range motions can damage these small blood vessels. And so the mechanism behind that is if you get a tear in the artery wall, you'll get a clotting response, but then the clot can dislodge and then go to the brain and cause an infarction or a stroke. So neck pain and severe headaches can precede a stroke for a few days. So that's important to know. And so there's a link there if you want to know a little bit more about manipulations. So there is some small evidence to show that an inappropriate crack of the neck may injure the lining of the blood vessel wall and potentially lead to a stroke. So precautions that we take as a physiotherapist is a vertebral artery test, where you get the individual to turn their head 10 seconds to the side, 10 seconds to the center, and 10 seconds to the other side, 10 seconds to the center. What you're looking for is a delayed onset of sick, dizzy, nausea, just a facial numbness, tingling. So basically, when you turn your head, it shouldn't create any symptoms. If you're getting any of those weird symptoms, then that would be considered a positive test. So anyone who showed up positive for that test, I would not be getting them to do shoulder stand or headstand at all. But just down here, I added a little bit of a picture here, because if you think about our yoga practice, normally the shoulder stand and headstand comes later on. It's usually sequenced to the middle or end of the practice. So there's actually plenty of time in the lead up to that in poses like Trikonasana to get the person to turn as far as they comfortably can one way and hold it for 10 seconds. Then have a pose like Tadasana for 10 seconds in the middle. You could repeat it on the other side. So you'd be doing some type of version of the vertebral artery test and warning people about some of these troubling symptoms they might experience. And then you're giving the student a way that they can test their own body and make a wise decision later in the practice. One thing I've started to do more recently is to make sure that everyone who does shoulder stand uses at least one blanket, if not two. So I would suggest that you ask your students regarding acute onset of headache or neck pain, if they've had manipulation recently, or perhaps if they're having treatment with a chiro, a physio or an osteo, because for their neck, or maybe even not, they still may have their neck manipulated. Ask about visual disturbances, halos around objects, floaters, especially if that changes after they've done headstand. And maybe review student intake forms to see if you can capture this information, but it can change week to week, month to month. So allow some check-in time for each class. How are you today? How's your neck feeling? And maybe understand what you're trying to achieve with a headstand and shoulder stand, and can you achieve it in another way? Perhaps also consider how, when and where you teach these postures. Are these postures appropriate for really large classes of people with large range in ages and experience levels, general health conditions, and risk factors for something like stroke, which can be absolutely devastating? But thankfully, the vast majority of injuries are not as serious. They may not warrant any medical attention, but they could cause time off from yoga practice. So let's have a look at that a bit closer. So about half of hospital admissions for yoga-related injuries were due to the trunk, as we looked at before. And my experience is this presents as stiff and painful backward bends, and you can't consistently do them without pain. Forward bends that don't improve, feeling tight between the shoulder blades, arm loading imbalances, and stretches, so shoulder and wrist pain for upper limb loading or end of range arm positions, twists that don't seem to improve, so core strength that doesn't seem to improve, and clarity on what is good posture. So why do people get injured in yoga? So yoga-related injuries are related with lower experience, greater age, increased hours of participation and intensity of participation. And there's a question mark over the training experience of the teacher. And with the increased popularity of yoga teacher training courses of various standards, and there really is a lack of official governing bodies and regulations of the industry. So I volunteer as a member of Yoga Australia because I think it's really important to have a governing body, but we aren't. No one is forced to be regulated, so that can create a problem as well. Some of these studies, though, did look regarding injury, looked at injuries presenting to a hospital. Like I said, not everyone goes to an injury, takes their injury to a hospital. And at least a third of yoga practitioners who are injured, there's some evidence to say they'll take a break from yoga practice. So if Patanjali says sthira sukha asanam, stable, comfortable postures, given the rates of injury, is this actually happening? And understanding that people carry their pre-existing injuries and we have to adapt postures, and yoga teachers have to guide their students on not only what to do, but how to approach each asana, as well as their whole entire practice. So if we can work intelligently on our own bodies, we can help our students do the same. But this does require knowledge of anatomy and biomechanics. And my experience is that we often hit blocks in our yoga practice and can't seem to progress. And this seems to be where injuries and frustrations occur. So common postures that cause pain and injury, anything that involves end of range movements, especially sustained there, repeated loading, and examples are twist, backward bends and forward bends. Upper limb loading often is a source of injury to the shoulders and wrists, and hips and low back can be injured by forward bends or deep or sustained forward bends. But the key really is end of range and repeated loading. So consider how you approach the asanas. Sometimes it's not the postures that are the problem, it's how we approach them and what instructions do we give our students in what they should and shouldn't feel. How do we assess for each student if this has been a good or bad posture for their body at this point in time? I think we can all think back to a time where we've done a posture either ourselves or a student, and some days it works and makes them feel better. Sometimes they go home and after the yoga practice, maybe we've felt worse. But how do we know which postures to select for this individual? Because it's a combination of frequency and intensity which gives us our load, and that can be either in one session over and over and over again, or over the week, or over a longer period of time. And also, are we using adjustments, hands-on physical adjustments? Consider what you're trying to achieve with this extra pressure, especially if the end of range, maybe the person's already repeated similar end of range postures. Is it appropriate to be doing this? But also considering that pain is not the only troubling thing that we get in our body. Sometimes it's just we feel stiff, we just can't get more flexible, and that's our strength maybe doesn't improve. Other things are headaches, urinary urgency or incontinence, having to rush to the toilet in the middle of the yoga practice or straight away after, and difficulty getting deep, good breaths, maybe puffing and panting, or having difficulty with those sustained breathing pranayama techniques. So my approach is a whole person approach. If you can find a therapist who can work the same way, then I would highly recommend working with someone. So improvements in flexibility and strength rely on more than just repetition. If you're repeating it and you're not getting a different outcome, something needs to change. And so we need to understand physiologically what happens when we're trying to get stronger or more flexible. Understand what our role is. So as a yoga teacher, we can identify those issues there and then refer on for more specific help. We don't have to do everything as a yoga teacher. We don't have to diagnose and treat all the issues. And also we could create networks of skilled practitioners who work with yogis and understand complex demands. So there are, here's a link to find a physio certified practitioners in Australia. So in summary, yoga-related injury is a serious issue. The way we approach our asana practice will determine how safe the postures are. So consider age, gender, medical complaints, our experience, and the level of participation of our students in other physical activities. So here are my top tips for helping deal with injury in yoga. Continual professional development. I can never get enough. I'm always reading, always attending courses. So the more you learn, the better place you'll be to be able to recognise when issues are starting. Maintain your own personal practice. So if you can hit a block and you can work through it or find a manual therapist who can help you, then you'll be able to use that information to help your students. And maybe consider how and why you perform hands-on adjustments. What are you trying to achieve, and is this the best method to do so? Consider the most risky postures. How, when and where do you teach them? So headstand and shoulder stand. Maybe they're better to be taught in a workshop format, and you can go more detail, more support, be more eyes on, hands on with each person, and maybe we don't need to Do headstand or shoulder stand in every posture. And is it appropriate where you work to have a more homogenous group? So can you have beginners in one group? Could you have men of a certain age in another group? So I guess from a business perspective, you might be able to create niche markets, but you could also make it a bit safer for your students if you can have people with similar complaints in a group. Not always feasible, but possible. So if today's just summarised some of the literature. There's lots more to cover. So in my courses, we delve into the specific biomechanics of different regions and building strength and flexibility around those regions. We talk about core strength, again, in different regions of the body. But I'd love to hear what your issues are, what common questions students ask you about their yoga practice, and if there's some injuries you need to know about to help your students work through them. So you can reach me via email. Like I said, there's a course series launching soon, and I'll have the details on my website, emilyiglesias.com.au, and I'll put it on the Facebook page as well. I also have a physiotherapy business called Physioga. We're based in Unley and in Strathalbyn, in the Adelaide Hills. So I'd like to acknowledge Dr. Linda Joy-Lee for her inspiration and her work, for Yoga Australia for allowing me to present some of this material for them, and thank you for your interest. Here's the first page of references to some of the information I mentioned, and a little bit more, and that's it. So I hope you found this informative and helpful, and I look forward to working with you and hearing from you soon if you've got any specific questions.